Good morning, everyone, and welcome to today's webinar, Medication Safety Experience in Saudi Arabia. This webinar is organized by the Saudi Patient Safety Center in collaboration with WHO EMRO. First, let me introduce myself. I am Alal Umari, Patient Safety Specialist. I will be responsible for hosting this session today. This session will last 60 minutes. 45 minutes for the presentation, and the last 15 minutes will be for the questions. Before we get started, I'd like to go over a few tips so you know how to participate in today's event. You will have the opportunity to submit a text question to the presenter today by typing your question into the question pane of the control panel. You may send your question at any time during this presentation. I will collect all this and address them at the Q&A session at the end of today's presentation. So to start, I would like to welcome and introduce our speaker for today, Dr. Thamer Al-Shammari. He's an associated professor of health outcome and assistant professor of clinical pharmacy at King Saud University. Also a distinguished expert worldwide for the Seen Center of Drug Safety and Policy Research in China, senior researcher at the Medication Safety Research Chair at King Saud University, a senior advisor in the Saudi FDA, also a chairman of the Saudi Pharmacist License Examination at the Saudi Commission for Health Specialists, a chairman of the Higher National Pharmacovigilance and Drug Safety Committee in the Saudi FDA, also an ambassador for the British Pharmacology Society for the Middle East in prescribing safety assessment, a fellow with the International Society of Pharmacovigilance. Also, Dr. Al-Shammari was the first Saudi who did his postdoctoral fellowship at the Food and Drug Administration at the States, and he served as a dean of the College of Pharmacy in the University of Hayat. Also, as you know, all know, Dr. Shammari has over 100 publications in peer-reviewed journal. So this is our speaker for today. And now, Dr. Thamer, if you please, you can start your presentation.
Thank you, Dr. Ala. Good morning, good afternoon, good evening, wherever you are. Bismillah ar-Rahman ar-Rahim. As-salatu was-salam ala Rasulullah wa ala alihi wa sahbihi ajma'in. It's really glad to be here with you today. And I would like to thank the Saudi Patient Safety Center for their invitation to talk with you about our experience here in Saudi Arabia. This a discussion webinar, I would like to hear from you a lot, and I would love to get your feedback. I'm sure we have different experiences among all of you. As Dr. Ala mentioned, my name is Thamer Al-Shammari. I'm actually have different affiliation and work with when we talk about King Saud University, we talk about the Medication Safety Research Chair at the King Saud University, in addition to what Dr. Ala mentioned. So this is just my disclaimer that these are my own view, doesn't represent the WHO Collaborating Center on Patient Safety Policy and Strategies, or like inviting me to talk in collaboration with the WHO and also the Saudi Patient Safety Center. So I'm sure all of you, at least most of you, saw this logo on this picture, which is the logo for the Medication Without Harm. And this is this is one of the initiatives that we are using. This logo is telling us that everyone from us has already did take a medication, or at one point of time will need to take a medication. So for you, for your family, for your parents, for your children, you need to take a medication for them or for you. So, and the medication, as all of us know, that these are not really absolute safety, and some of these medications has mild risk, some moderate, and some have severe risk. So that's mean we really need to be vigilant and to be focused on the medication. So I'm assuming that you all are hearing me. So if there's any problem with the voice, please you can tell the moderators. I'll try to fix that. So why medication error? And again, these statistics that's already from the WHO are really a shocking numbers. When you take a UK, which is one of the developed countries, and you found that almost over a $250 million medication error occurred every year. This is a really dangerous, specifically when it's like over 5.5 million of these are really clinical significant. Okay, that's mean it led to the harm. It might lead to the hospital, might lead to the serious. And it's more devastating when we talk about the area with low and middle income area, because these are the risk is really double the other countries. And if we talk about the Middle East countries, we have all type of countries. We have low income countries, we have middle income countries, also we have high income countries. So that's mean it's really, we need to focus. We need to take case by case when we talk about the how to design programs, how to assess the medication error, how to evaluate them. So it's really important. So what's applied in Saudi Arabia, for example, not necessarily to be applied, for example, in Syria or in Egypt or in Morocco or in Iraq or even Europe or even Pakistan, Afghanistan, and etc. Or Australia, for example. So we really need to take it, but we need to learn from each other about these risks. I'm sure all of you there that know of these stories, but I'm mentioning here because I want to deliver a message. The safety issue or risk of medication is really not something new. And this is a little girl. She was 15 years old. Her name is Hannah Grenner in 1884. She was fine. She was healthy. She has to do a small plastic surgery. Her parents took her to the hospital, to the clinic, actually. And unfortunately, within 2 minutes, Hannah died because of using chloroform as an anesthetic agent, which is a toxic agent that cannot be used. So this disaster could be prevented if we could prevent unnecessarily surgery for this little kid. Bit Suleiman, this is really a story that in the US make like a lot of announcement to take care of the safety. Bit Suleiman was specialized in the health issue, working as a newspaper journalist. She had a specific column for health. She was fine. She was only suspicious of breast cancer. She went to the hospital by herself to just do the examination. Before they do the surgery at that time, they want to give her chemotherapy. Unfortunately, instead of giving the right dose, they give him quadruple time the dose from the cyclophosphamide. And unfortunately, nobody was listening to her, and she died within 3 days. And she was only 39 years, and she has 2 daughters, and this is one of her daughters. Again, if we listen to this, to Betsy, which is a knowledgeable person, educated person, from the nurses, from the physician, from a pharmacist, we could also prevent that. Amin is one also of the patient. He has only elevated uric acid, doesn't need to be treated, and in where he's from, they have high gene mutation against the drug called allopurinol. That means should not be used unless there is a need. Unfortunately, the physician prescribed to him, and unfortunately, the patient died because of this reaction. That's a preventable reaction. And similar to the Martha, when she was dying because of her hypokalemia, that can be easily treated by giving her potassium. And again, this is of communication. So this is all we talk about almost 200 years, and every day we have safety. So that's me. We really need to focus. We need to prevent this risk and to work more and more. So I have a question for you. So again, as I mentioned to you, I would like to make this interaction. So there are different initiatives by the WHO called WHO Global Patient Safety Challenge. Which one of the medication, which one started as a number? The initiative was called Medication Without Harm Challenge. So please, if you can answer. So is it the first initiative by the WHO? Is it the second initiative? Is it the third or the fourth initiative? Let me test you before you test me. Let me see if nobody has a problem. Okay, nobody has a problem. Good. I think, okay, are we done? Yeah. So, okay. So majority actually answer well. 38% of you answer third initiative. Some of you say second, some say first, and some say fourth. Actually, it's the third initiative. The first initiative was clean care, which is end up with having this, all of you, like the gel that's in the hospital, and now with the COVID we have it to clean our hands. And the second initiative was safe surgery, save lives, because we have a lot of issue with the surgery. And the third one is called medication without harm. Well done, all of you, most of you. Thank you. So the third initiative, as most of you know that, it's called medication without harm, and this is done by the WHO. And someone asked why we need it. Because it's really important. As I mentioned before, it's everyone in this world already had taken or will take medication at point of time. So, and we know there is no absolute safety from this medication. In addition, the global cost of medication is really, really high. We talk about 0.7% of the total GDP worldwide. We talk about 42 billion US dollar annually. This is a huge amount of money. It's the third leading cause of death in the US. So this is really something serious. That's why we really need to. And unfortunately, if we talk about in the hospital, lead to hospitalization, harm to the patient, disability. It was launched in 2017 and one of the Global Ministerial Patient Safety Summit in Germany. The purpose of this initiative is to reduce the global of severe preventable medication-related harm by 50% in the next 5 years. And this is different between country to country, because first you need to know what is your risk from medication in your country, and then you need to reduce by 50%. Let's say you have 10% of risk from medication, then you need to reduce by 5% from the distance. So someone's like 50%, they need to by 25%. So and so on. So this is really important. And it was coordinated by the WHO Patient Safety and Quality Improvement within Department of the WHO and in Geneva there. So this is just an introduction with that. So I'm going to talk about what is our experience in Saudi Arabia. First, Saudi Arabia is really big land. We'll talk about over 2 million kilometers square with 13 regions that we have in Saudi Arabia, and a population over 35 million people, are really increasing as sort of population. And the risk of admission or in admission to the hospital in Saudi Arabia due to the drug, based on the research, we have almost 15% ER admission. It's a little bit higher than the international percentage or incidence, which is almost talked about between 6 to 8%. This is earlier before. However, recent studies, they found that it's almost similar to the international rate. So let me ask a question that for those who especially might know in Saudi Arabia, which is almost close international. What is the most processes in the medication user process that medication error occur in Saudi Arabia? Which one has highest incidence of error in Saudi Arabia? We'll talk about prescribing, dispensing, and administering. I'm not sure if the ball is ready to show it to the so the people they can select. So which one you think is more prescribing, transcribing, dispensing, or administering? You can put in the chat until waiting for the poll. Yeah, wherever we have the poll now. So which one you think it has highest? All of them, they have a risk, but which one has highest one? I will talk prescribing, which is physician and some pharmacists, transcribing, which is nurses, dispensing, which is pharmacists, administering, which is nurses. Let me see. Good, good, more. Yes. Okay. So majority of you say administering, followed by prescribing, followed by the dispensing and prescribing. We'll know that now if you get it right or not. So this is international, the WHO, the highest was the administering, which is similar what you thought, followed by prescribing and then dispensing of medication. However, the situation is different in Saudi Arabia. We actually have done a study in the Saudi Arabia. We took all the medication error by the Ministry of Health, which is almost over 71,000 error in the Ministry of Health, and we classify. If you want to go to the study, it's this link. And we found actually the highest number of incidents of error was associated with the prescribing error, and then followed by dispensing error by the pharmacist, and then transcribing by the nurses. It's not similar to the WHO, but it's similar to many countries, including the US. So prescribing is really one of the highest that we have in Saudi Arabia. That's why we need to focus in our planning, like electronic prescription and all of these double check of the prescription, and also the handwriting is really important by our colleagues, those prescribing that. And when we get too deep in these error, which is over 7,000, we found the majority of them were due to oral, which is it's well known, and the majority of medication was associated with antimicrobial, analgesic, hematinic, cardiovascular, and neurologic medication. So antimicrobial, again, it's commonly and everywhere. The most important part of this, it's why these errors happen. In this study, we found that high workload is really highest percentage. We know the pharmacists, physician, nurses, all of them, they really have busy time. They don't have enough time to check. And this is not excuse, but this is the reality. Followed by inexperienced personnel. That's why we need to focus on educating and training a lot of our employees, either junior or even senior. Some, they say that we don't have lack of policy, or they say the information that there is no lack, there's no policy, and some of them, they do not work adherence. So these are really important. This study published in the Journal of Patient Safety. So for those who doesn't know the healthcare system in Saudi Arabia, let me ask you, what is the healthcare system model in Saudi Arabia? Is it social healthcare system? Is it insurance-based healthcare system? National health insurance system, which is by private, publicly funded healthcare system. When we say social, that means it's by the government, insurance-based, but there is private company. National health insurance system, it's by the government, but through insurance, private companies. Publicly funded healthcare system, that's by taxes, from the taxes. So which one you think? Let me know. Let me see how much you know about Saudi Arabia healthcare system. Vote. Yes, more. Okay, see the number increasing. Okay. So majority say it's publicly funded healthcare system, followed by social healthcare system, and then insurance, and then national healthcare system. So we'll let you know that. So the healthcare system in Saudi Arabia is actually social health system. It's paid by the government. However, we also provide, there's also private insurance company for some like employer. This is also increasing in Saudi Arabia. So this is the system in Saudi Arabia. We have mainly like provided and regulated by the, as a practice, by Ministry of Health. We talk about 60 to 65%. of the health services is provided by the Ministry of Health, and some also provided by non-Ministry of Health sector, but it's still government. We talk about Ministry of National Guard, Ministry of Defense and Aviation, and Ministry of Interior. We have almost over 84,000 beds in all hospitals in Saudi Arabia. We have over 2,300 primary healthcare clinic. And this is all, again, as mentioned to you, is provided to help the patient. The Ministry of Health is working as supervising and also providing the health services. However, later on, with the transformation that Saudi Arabia is undergoing, we'll see the Ministry of Health is only regulating and supervising the health services, and the services will be provided by a third party. So we've got details on medication safety history in Saudi Arabia. It's not really something new that we have in Saudi Arabia. Mainly started in late 1990s with like shy tries that in Saudi Arabia. In early 2000, we started to be more focused and mature, and it's really going very good, and it's really going, growth is very good here in Saudi Arabia. So we talk about Saudi Arabia. Compared to other countries that's close to us, are really doing good. However, we still need to do some work in some area that we still are weak on in these areas. Mainly, we have two big institutions that are really working in medication safety. We talk about Ministry of Health and also Saudi Food and Drug Authority. However, we have different sources for medication safety, not only, not working in this area. We also take the information from regulatory authorities, local, like Saudi FDA, or even international FDA, MHRA, EMA, the Ministry of Health, Saudi Arabia, ISMB, Institute for Safe Medication Practices. We also built our own measurement or all guidance. I'm going to talk about them later. We also have what is really important body, Saudi Central Board for accreditation of healthcare institution, are really doing good and talk about. They have a specific section on medication and medication safety, and also another accredited body, which is Joint Commission International, which is international accredited body. We've also a great work done by our colleagues here at Patient Safety Center. We're going to talk about that later. Also, the good thing is Saudi Arabia with collaboration between different institutions, the Sibahi, the Patient Safety Center, Saudi FDA, Ministry of Health, and also with the Saudi Commission for Health Specialties. Also, we applied in some hospitals our own standard and the increase of the medication safety officer concept in Saudi Arabia. So when we talk about medication without harm, it's really affecting us positively. It's helping us positively. And we are lucky that we have also in Arabic. If you need any information, go to the WHO website, you'll find all these information. So I'm just announcement. I'm not going to talk about all the activities because I only have like short time. I'm touching the most important. And please, if you have any question, I'll be happy. I'll send about my email later on if I have a question, and also my Twitter account for anyone who has a question. So for Saudi FDA, they have medication safety medication error department. It's really getting more attention after this initiative, starting to have what's called regional office initiative. That's a pharmacist or physician or nurse working in ex-hospital, that this person is really working with Saudi FDA, helping them for education, for training, for also collecting ADRs, adverse drug reaction to them. We also have a very unique system, so the adverse event reporting system that accepts all report from everyone, patient, consumer, healthcare professional, and also you can send an email, apply online, fax, you want to call them. And in 2019, they have a campaign to increase the number of reporting, and it reached up for over 40,000 report from 3,000, only 3,000 reports. It's really getting more work, and really all of this because of this initiative. This is the website. If you give information about the pharmacovigilance Saudi Arabia, and if you see one of their tasks in Saudi FDA is medication error. It's really focusing on it in details to trying to limit all the preventable error to prevent and also not happen to our patient. And this is the, as I mentioned, reporting form. You can send it online. You can write in the form, and you send it to them. When the FDA gets the report, they evaluate each report case by case. Want to know what's happened, why it's happened, to try to prevent, or to try also to minimize and like risk minimization tools or measures to prevent that. Also to evaluate the label. If the label need to be changed to avoid mixing with other medication, either look alike or sound alike. Also, they ask, they have overpowered the pharma company, so they change it. And again, it's really getting more and more and talk about Saudi FDA. They do a lot of educational program, software program for both healthcare professional and patient, and have the initiative of medication passport initiative to get all the medication with you in your phone, so you can everyone know what medication you're taking. One of more really important activity was called trust. In Arabic, trust means monitoring, follow up. So this system is helping us, or is helping Saudi FDA to monitor medication from the manufacturer until getting the patient. So if anything happened to our patient, especially when we talk about recall, they will know where the problem is. And also in case of counterfeit medication, it's really important to prevent that. It's really great to solve like a system that is going to help the Saudi FDA very well. Also, the communication with both healthcare professional and patient, it's really doing very well, and trying to increase the communication, because without communication, you will really might lose some important information to deliver to our patient. So we talk about health institution. Some health institutions, they're really using the WHO or ISMB guidance to assess how are they doing. And this is just an example. This is to evaluate them if they have these standards. We talk about the patient information, drug information, to talk about communication, specific for high alert medication, again, with the WHO also guidance. I'm going to talk about this later. And this is the demographic for the patient, the drug, this example of using high alert medication, Tolman lettering, and how to avoid the mixing up with the sound alike or even look alike. And this is for specific drug that they need to be carefully being used. For example, this vincal alkaloid to be intravenous use only, fatal if given by other routes. So it's really important to see if this hospital, and this will apply in some hospital. Also, they have local guidance by the hospital. We talk about the drug shortage, we talk about the medication error, we talk about drug sample, and etc. This is an example, and there's another example for lookalike, and this is also for the risk of medication. I'm just going to example of this, the example that we have in Saudi Arabia. This is for you, how you use the medication in the pediatric, and also the prescription privilege for the physician. You know, physician, they're not all physicians have similar privilege, because some medication should be prescribed by specific physician based on their specialties. And this is one of the important tools to verify the telephone or verbal order, and it's only limited for some of the medication. And this is for the order fill, and this is for compounding, for storage condition. And at each year, they evaluate how good they are in area of the safety of the patient. And this is the need for having committees within the medication safety program. And this is just follow up what we are doing. So most of the hospitals, they have what they call it medication safety committee. It's usually multidisciplinary team, have physician, have pharmacists, nurses, medication officer, people expert in the area, talk about epidemiology, talk about the area of health outcomes. And usually they meet every 2 weeks to explain or to discuss all the information that we have. And this, again, the continuous evaluation, if this institution, they did met the information or not. And this is just an example for transition of care. So question number 4, when is the World Patient Safety Day? Is it on 17th September, 22nd September, 17 November, or 25th of November? Please vote. Okay, so majority, they say 17 September, followed by 17 November, and followed by 25th November and 22nd September. So the World Patient Safety Day is actually on September 17th, which is majority if you have got it. I mentioned it here because since it started in 2019 in Saudi Arabia, they are really acting taking this seriously, and we did a lot of activities, especially by the Ministry of Health, and we this is the first one we have done it in Saudi Arabia. We were from the countries who participate in this event. As I mentioned, it's done by the Pharmaceutical Care Department Saudi Arabia, Ministry of Health Saudi Arabia. It was really huge activities. We have over 100 hospitals and clinics participated. It's really huge. Everyone was active. Everyone was enthusiastic to participate in this one. Even on the country level, we also, this is the Kingdom Tower, one of the tallest tower here in Saudi Arabia, in the Middle East. It's colored with the orange, which is the orange color is for the patient safety day, and these all the activities by our colleagues in the Ministry of Health of their campaign, talking with the patient, talking with the healthcare professional, discussed together. So all of these activity, a lot of campaign have been done over not only one day, actually several days in Saudi Arabia. And this is in another city, and this is all the activities that we have. It really was, when we start, I was not expected to have this, but it's really good and great example. And we'll be happy to share with you the success if anyone interested with that. So one of the few centers that we have, not Saudi Arabia, I mean, worldwide, which is called Patient Safety Center. We don't really see a lot of this, but it's really lucky to have such center in Saudi Arabia. And this center has different like objectives. One of them is for education and training, and also to set the guidance, a standard, what we need to do on the safety patient safety as patient safety. Also, it's important. The one of the role is to enhance the patient safety culture. It works as an umbrella for most of the activity of patient safety, and as a cornerstone for patient safety, and also to work as a coordinator or collaborator between different stakeholders that's really focusing on patient safety. And also, we're lucky that we also have one of the 3 collaborative centers in the Middle East, in Arab countries, which is the WHO Collaborating Center on Patient Safety Policy and Strategy. It's really unique. It's really important to have such. And they have different campaign. We talk about the patient safety caravan. We have training education, focus on medication safety, and also there is an annual or like periodically hospital survey on patient center. One of the success that we have here in Saudi Arabia is organizing the 4th Global Ministerial Summit on Patient Safety. This was in 2019. Because it's important, it was under the patronage of the custodian of the 2 holy mosques, King Abdulaziz. And it was led by His Excellency Dr. Tawfiq Rabia, who was ex-Minister of Health, and also His Excellency Dr. Tedros, the Director General for Health World Organization. And this is just the photo for all the ministers who attend this one. It was the fourth one was done in Saudi Arabia. And this is the 3 people is really leading the patient safety. The Dr. Tedros, all of you know that. Also Dr. Tawfiq, and also Dr. Jeremy Hunt. He is advocate for patient safety. He is well known in the UK. He was the Minister of State in the UK, and also is advocate about in patient safety, and still until now working with the WHO with that. Also, there's a lot of, as I mentioned, the collaboration by the Patient Safety Center with also other institutions, like this is for with the Saudi Commission for Health Specialties, and this is when they signed it just 2-3 weeks ago. Again, there's a lot of activities, but for time to want to cover as much as you can what's happening here in Saudi Arabia, this might help you to to apply it in your place. So SIBAHI, which is Saudi Central Board for Accreditation Health Institution, it's now mandatory all hospital, either government or private, to be accredited to make sure they apply all the quality aspect with the providing the health care. It's really important. It has a great part of the medication as to assess that. And this is just an example of the standard that they're using. That's really important. And if you really want, you have their guidance online, you can access them. And this is when the hospital, they really need to audit themselves. I mean, when they do in the hospitals, usually every 2-3 weeks, audit in specific the nursing station, pharmacy, and also performed by the expert for the audit. With other activities in Saudi Arabia, we talk about the reporting from the hospital, within the hospital, with the private pharmacy. The concept of regional pharmacovigilance offices is really increasing. Medication counseling, reconciliation, handling of cytotoxic medication. We talk about the antimicrobial stewardship program, which is really important, and the safe purchasing with the by the NUPCO, with the collaboration with the Saudi FDA and also with the Ministry of Health. So last point, before the last point, to talk about the pharma. Also, when we talk about the pharma, it's really doing good, especially the one in Saudi Arabia. And this is where the website for the Pfizer company, they have full in Arabic, they have all the information. Even if someone wants to report an ADR, is really have it there. You just submit it and send it to them. This is one of the examples. Also, Amgen have the same. Spimaco, which is called Ad-Dawaiya here in Saudi Arabia, also have that. You can submit it. Also, if you get any information you want, you can get them. This is Tabuk, another pharmaceutical company, which is local pharmaceutical company. You get all the information. And also Aja pharmaceutical company. Also, they have the information, so you can access. So pharma, especially the local one, is really doing great. The international, not all of them, still many of them are not really providing this information. This is also will be changed after this initiative. Last point, talk about the research. As different countries, we don't have really a lot of people, especially in this area. We have some trying to evaluate the current situation. This is one of the research that we have done to assess what type of report that we have in Saudi Arabia that provided to the by the healthcare professional and also the pharma. This one is that when we talk them of information from the Ministry of Health and to study them and to know what really the situation in Saudi Arabia, and this again published in the Journal of Patient Safety. There's another study or systematic review done by other colleagues. And this is we actually tackle the pharmacy as source of the error, especially with the medication in community pharmacy, which is we try to discover what's going on even before when they think about the pharmaceutical community pharmacy. This one is one of the good study that's been done to assess the rate of ADR here in Saudi Arabia. This is really important study. And this is when we did to assess the problems associated with polypharmacy in Saudi Arabia. And the last one that I'm going to mention about it, which is the know what's kind of situation about the safety or the pharmacovigilance from the regulatory point of view, and also the pharma, what is the situation in 22 Arab countries that we have. And it's really giving a good reference so everyone will know what's happening in this part of the world. You can access and get all the information. However, we really need to do a lot of research in this area because a lot are missing, either like in Saudi Arabia or even outside, everywhere. This is not something related to a specific country. All the countries, they're really working on this in the research. So last question. Introducing the technology will always impact positively in patient safety, especially in area of medication safety. So having technology always is good. Yes or no? Okay. Majority say yes. We'll see. So actually, the future plan here in Saudi Arabia, it's really to expand the use of technology, system, and software. However, we're really using them, but we need to expand in that. We need to expand the number of medication safety officer, and this is one of the plan. The role of community pharmacy is really important, especially we're going toward the utilizing community pharmacy. Also, the pharma company, they have a major role, and also there's some work on this, and also need to have some specific training program in the area. So the evolving technology, it's really being done, not all electronic, it's also not only the pharmacists, also there is a need on the other department, like lab, medical note, etc. However, be careful when using technology. Too much technology could lead to error. So the question that I mentioned before, I would say no, because we have to be careful when we are utilizing the technology in our, we need it, yes, but we have to be careful. So from the academia point of view, there is some increase on the concept of prescribing safety assessment. It is a training program adapted by the British Pharmacological Society, and we try to increase it here in the region. We have actually did in UAE, but also there is some working, will start to do by some university here in Saudi Arabia. They just test for those who prescribe, either physician or even pharmacist who can prescribe. And there's specific guidance. You need to follow up this principle, and they will be a good prescriber. So what's the challenges? I have only 2 minutes. What's the challenge that we have? We talk about lack of human resource, and this is again problem everywhere. We don't really have enough experience, trained personnel. It's a new concept, so don't worry if you see many people they're not aware of. It's because it's really new worldwide. It needs more effort. You need to do a lot of training. You need to empower your employee, give them the confidence to say, yes, this happened, this wrong, we need to fix it. It's not only from the hospital, it's from the practice, regulator, and the challenge that we have, some area, they still don't have a good infrastructure. And we, from the academic part of view, we need to have more interprofessional training and communication. Study together, pharmacists, nurses, physicians in the university before they work together. So in summary, medication safety is really very dynamic, growing fast. We're doing well in Saudi Arabia. However, as I mentioned, we need to improve in some area. There's a need to work between hospitals, regulators, and pharma. We need to focus on human resources, really, really important. We need to use technology. However, be careful from using technology. I'd like to thank all of you. This is my email, and this is my Twitter. And before I go there, always remember in patient safety to always look around you. Don't look only in your friend, like this duck who's stealing your money. So we need to go to look at back, right, left, to make sure everything is really well. So I would like to thank you all for your time, and I hope you benefit from this presentation. And please feel free to contact me if you have any question. I'll be happy to answer. And I would like again thank for the WHO, the WHO Collaborative Center on Patient Safety, Policy and Strategy, and the Saudi Patient Safety Center for giving me this chance to be with you today. Thanks.
Thank you, Dr. Thamer. We're now going to begin answering the questions submitted during today's presentation. As a reminder, you can still submit any question if you have any in the question pan in your attendee control panel. So, Dr. Thamer, I have here one question. While you were talking about the technology, one of the participants, I think, one of them just he has like a comment. It's like using technology is not always leading to improvements. So
yes, always using technology. Well, I agree that sometimes it might lead to actually an error and could lead to tragedy. That's why, as I mentioned before, using technology, not always the solution. We need to use technology. For example, we need to use like electronic prescribing that will limit the handwriting, which the handwriting is really a problem. So yes, we should not always use technology. However, in some area we need them. And even when we use them, we need to monitor them. We need to follow up. We need to, calibrate this technology to make sure. So yes, that's true, but we need it at some point of time. But as I mentioned, we need to follow up and make sure we are using them correctly.
Thank you, Doctor. So another question is that right now all the focus is on the hospital and primary health care. But there is another party who use medication, for example, like community pharmacy, private clinics, and private hospitals. So I think they have an underreporting issues. So how can we increase the awareness of medication safety?
Excellent. Yes, the underreporting is really a problem everywhere, government, private. But when we talk about community pharmacy, yes, it's really one of the important area that we need to focus on. In Saudi Arabia, there is some activity actually, even in the reporting during this campaign. Some of these reports are submitted. We talk about like 47,000 reports. Some of them are from the community pharmacies, and some of the chain that we have in Saudi Arabia, they're really doing well on this. They're really teaching them teaching the healthcare professional how to report, and also they use it as a way of the advertisement for their service. We provide with the service. We teach about the safety of medication. We make sure from this medication. So there is some work. And also some of the chain pharmacy that we have, community pharmacy, they provide services like MTM, medication therapy management, as sort of medication reconciliation and counseling to limit the risk. However, we need to continue to educate them, to train them, to do a lot of campaign. Don't think that once you do it once will be enough. No, we need to do it continuously to educate every month to focus in one area. So with a lot of training, with a lot of education, it will really help in the either like community pharmacy, community hospitals, or even regular government hospitals or pharmacies.
Okay, thank you, Doctor. Also, we have another question. The problem of illegible handwriting. They asking if the technology is the only solution for this problem.
It depends. Some, not all handwriting is really bad. Some of the physicians really doing well. They do great prescription and all the information. The problems, the majority is really not doing good. What we have now is only the electronic prescribing. And what's the good thing is that now in the system, you didn't need to involve the patient. The prescription went from the physician desk to the pharmacy desk, and they check the information, they check the diagnosis, and we prescribe the right medication. And most of the hospitals here in Saudi Arabia usually will, when they have any issue, will communicate with the prescriber and ask about these, if there's any confusing. So what we have now is really one of the good solutions to have. In addition to those, we have very good handwriting. Yes.
Thank you, Doctor. So our last question is, our decision supporting system can add to medication safety activities?
Yeah. The decision supporting system is really important in the help the clinician, healthcare professional do for our patient. It's really one of the also important part in the medication safety. It's really helpful, and medication safety, since this question came to end, it's really involved in many activities, not only the medication when using medication itself, even when we talk about the interaction with other, either lab, talk about the other herbal, talk about the other disease itself. So we look from one side, but also we need, when we talk about medication, but we need to also look from different angles, different area that we need to cover in medication safety. Yes, it's very helpful. As I mentioned before, the MTM is part, and other parts. So medication safety advantage, it's really have a lot of activities can be achieved through this activity. Yes.
Okay, thank you, Dr. Tamer, for answering this question and for the great presentation. It was a pleasure to have you with us. So to conclude this or today's webinar, medication safety experience in Saudi Arabia, on behalf of Saudi Patient Safety Center, WHO, IMRO, and our presenter, thank you for joining us today. We hope you have learned and enjoyed this presentation, and have a great rest of your day.
Thank you so much.
Thank you so much.